Joining us now, Reverend Ben Knotts. He is the Legislative Director for Americans for Prosperity in Virginia, and he's also a man of the cloth. And he's with us now. Ben, great to have you with us.
Good morning, John. Congratulations on the new station, man. You're just literally taking over like Godzilla.
Anything that I can do to get more coverage for Ben, Reverend Ben, that's what I'm going to do, right? That's what I'm going to do, Knotts. Reverend Ben Knotts. Now, look, we got some, politics and legislation to get to, but you're a preacher by trade, and so is your dad. And so we're in a time of strife, right? No question about it. A lot of people not together, apart, a lot of angst going on, protests, riots, looting, a lot of people getting worried. Country is divided, totally divided, man. I mean, you can't even have a conversation now with a lot of people. You just can't even have a conversation. It's scary. As a reverend, how do you bring the disparate factions together?
Well, that's a very difficult question to answer. I believe it all starts with empathizing with people. When people act out, they do it for a reason. Whether that's your child or whether that's your spouse or a friend. And when you just say, oh, you shouldn't be acting like that, but you don't ask them, really, why are you upset and what you're trying to get to. Now, there are some people that just wanted to, that they're just trying to destroy things. But there are people that are legitimately hurt and they're upset. And if you don't stop, take a break and just take a breath and look and listen to someone, you really don't love that person. We're expected to love our neighbors as ourselves. And if you want to act towards a neighbor to someone, you need to listen to them. And you need to try to empathize from where they're coming from and try to get to a place you can move forward and do unto others as you would have them do unto you. And so you really just have to take that moment in and stop. I mean, right now on social media, if you get on Twitter, you just I don't even call it a real social media platform as much as it's a criticizing platform. People get on there not to to participate and have social interactions that are positive. They get on there to criticize one another, not listen to one another, not trying to understand one another. And so the Bible says a lot. It says, "Come, let us reason together." It talks about communicating with people, empathizing with people. I mean, Paul went to Mars Hill and spoke with people that believe completely different things, but they listened to each other so that they could see if there was places of commonality that they could work with Paul and believe what he was teaching. So, no matter who it is, Jesus wasn't afraid of being challenged or questioned. And now in our day and age, everybody has to get on and criticize. And I think that's a shame. But the answer is that we don't look at what other people are doing. We look at what we need to do. And we do it not because of what the culture is doing or what the politics are doing. We do it in spite of it. So I think that's what we have to do. Not if the politicians are doing it, but we have to do it. It has to be on us, the citizens, because it's we the people, we're the ones responsible.
So how do you start that dialogue, Ben?
Well, it's interesting. I actually had a pastor friend, Pastor Coleman downtown. And he said he wanted to get people to come and work with him. And so what he started doing was he challenged all of his friends who were participating in protests to put up on social media about how they felt, and they were he called themselves Black Builders. And I just loved that. And so I immediately reached out to him and said, people need to hear what you're saying, because it was connecting people with the pain of the situation in a positive way, in a way that says, we're Black builders. We're Black men that want to build our community and build one another. And I was so impressed by that. And so just that little bit of effort, that little bit of light in the midst of a whole lot of darkness really shined out to others. And I saw other guys taking this challenge. So, I mean, that was his way of doing it. Now, it's not a prescription for one size, fits all. Everybody has to figure out what their day is like, what their schedule is like, and they have to figure out how they can contribute to listening more and empathizing more. Because until we do that, until we empathize with people, and until we really see them as human beings, God, I call them image bearers of God, with equally created, then there's no real hope, because you have to look at someone regardless of their experience and see them as having equal value. And if you don't do that, you're really just going to look past them or dismiss them and not and not let them contribute to our our Commonwealth and our country.
Ben Knotts, he is the legislative director for Americans for Prosperity, Virginia chapter, Virginia division. Ben, telemedicine, when this started, you were on the front end of it. I remember we had a lot of meetings on it. People were trying to figure out what it was, and there was a lot of hand-wringing and consternation, and a lot of the doctors in bigger hospitals didn't want it because they were afraid they would lose money. They didn't want to go across state lines. They want to control everything. But you guys fought for it. I got my 91-year-old mother, Dolly, lives with us. We used to have to take her to the doctor every week. She go to the doctor, get in the car, go to the doctor. Now, since COVID, can't do that, all right? So now we do the telemedicine. Once a week, her doctor gets on the video with her. Anything that's wrong with her, we show it to him. And he's like, do this, do that, prescribe that, walk more, don't walk that way, walk this way for your physical therapy. She hasn't been in his office in 3 months, and she's getting better care because, everything is right there and it's totally accessible. Why isn't this going to be the way to do medicine in the future?
The only thing that could stop this from happening, I think we're beyond the tipping point at this point, but the only thing is the status quo that wants to go back to the control that they used to have over the system. Just think of taxi companies that wish they could go back to before Uber was a thing. Or I could go down the list of all the different technological innovations where it disrupted the competition. I bet Montgomery Ward and Sears and you name it, Kmart, they would like to go back to the days before Amazon wasn't a thing. And so just like all of those companies that refuse to adapt and embrace technological innovations, or they only wanted to do it on their own terms. We have a lot of people that are really invested in the status quo, John. And the biggest is like people that hospital systems that really rely on the emergency room to overcharge for other services. And, that's why I beat up on COPN a lot, because the reason I beat up on that is because with that, they have to raise prices on other things to pay for the indigenous, the charity care that they provide in the ER. And so a lot of the charity care is readmissions. People just keep coming back and back and back and back. So they'll lose a lot of money once this program we've initiated with remote patient monitoring, which reimburses monitoring people at home that would normally be going into the emergency room over and over and over. So, some of the well-meaning hospitals, I've talked to a bunch of them, they knew this technological innovation was coming, and they knew they needed to embrace it, and they were probably going to lose money in the long term, but they were going to save some because some of those expensive patients. But there are some people that they would rather have control and rather have the higher revenue and have the taxpayers on the hook for more and more money. And they're already having conversations about trying to rein in some of the innovations that the governor has allowed during COVID. So, there are adversaries to this, unfortunately, and I do hope that they don't get their way.
How do we expand this across state lines? That's really the next thing to be able to do is, so that you can go to any doctor that you want. And once you get this done, like doctors will obviously be soliciting your business, but, the bureaucracy in front of it, every time you have somebody blocking interstate commerce, right, whether it was the old car insurance days or now the health insurance days, it's so that some people that own the bigger companies can make more money. That's really always the obstacle, right? Somebody trying to gouge the public. So what stands in the way of just opening this up and getting it out of state line restrictions, Ben? And then how critical is that? Or does it matter?
Yeah, so think about it. Right now, Virginia has a direct primary care crisis. We have way more people that need direct primary care than we have enough doctors to supply them. Now, the technological innovations themselves actually lets doctors see more patients more often, or see more patients at once per day. That's one of the things. So it does give doctors more time. But at the end of the day, we still don't. Our supply, we lack the supply of doctors in our Commonwealth. And so as all the doctors embrace these technologies, it's in the foreseeable future that we can address this issue. But you have to remove unnecessary barriers. And one of those are licensing laws. And there's a couple of ways to approach it. 2 years ago, Terry Kilgore and Senator Favola passed a bill for us. And what that bill did was, very simply, it went across it said that we would create a telemedicine work group, and that work group demanded the Board of Medicine go to other states, other Board of Medicines, and establish reciprocal agreements with them, so that if a bad actor in Tennessee, a bad doctor in Tennessee is abusing his license on Virginians, but not the people of Tennessee, then our Board of Medicine can discipline them because they have this reciprocal agreement. So that's the main thing for them, is they want to make sure that there is discipline with bad doctors. But the reality is, if you look at the data, and there's been studies from Accenture, Hope Labs, you name it, the malpractice rate with telemedicine is so low. It's very, very difficult to misdiagnose or to because the scope of practice is limited because of what you're doing on a video chat. So that's a big portion of it. And I think it's a lot of those fears are unfounded. And the other portion is, like you said, if the federal government took action on this, because it is a internet state commerce issue, where someone cannot provide their services because of licensing barriers they put up between the states. I mean, if you go to the same college and you graduate with the same credentials and you've practiced a year or two, I mean, you're going to get quality care as long in most cases. I mean, so that's the interesting thing about it. They don't say that if you go to this college, you're not qualified. If you don't go to a Virginia college, you're not qualified to teach in Virginia. A lot of these doctors go to the same schools. So it seems kind of silly in a lot of ways, but it boils down to discipline is what a lot of the bureaucrats and people in the healthcare establishment want to see. But if you're licensed in another state, that's the state signing off saying this guy knows what he's doing, and I think that should be enough.
I think it should be enough also, Ben. Let me ask you one final question. In Virginia, what legislation now do we need to make this part of how you do medicine?
Yeah, so one thing I would tell somebody is right now is doctors were always wary of adopting this technology because they didn't know if their patients would want it or they could get reimbursed. So we've taken care of the reimbursement part. A lot of the people that directed the telemedicine task force are directing the pandemic task force, and now they're going to be turning that into our state telehealth plan that passed this year. So that's encouraging. So ask your doctor, hey, how can I use more telehealth in our interaction? Or, look at some apps you can download. That really, if the market demand is there and people start doing this, they're going to respond to it. But on top of that, the thing we really, really need to do is we're going to be taking this, we need to make sure that reimbursements stay permanent for doctors that are using these technologies, particularly remote patient monitoring, things like that. And you got to talk to your lawmaker and make sure that they're on the side of reimbursing for telehealth. If the FDA's approved it, we should be able to use it. I mean, that's it. But in Virginia, there's a lot of things that might come to market and might be approved by the FDA, and they'll still put barriers down on it. And so there's just a lot of unnecessary barriers around the supply side of care that we can address. And I think in doing so, we're going to see the prices start dropping dramatically, and that's what we're seeing.
Ben Knotts, you've really done magnificent work here. And I got to tell my audience, you were a very lonely voice 2 years ago, pushing the telemedicine. Nobody even knew what it was. Nobody wanted to talk about it. It was not a sexy issue to speak of. Papers didn't really want to cover it. The only one that covered it was me. And the reason I covered it was because of your dedication, persistence, and passion. Because you'd call me up and say, I want to talk about telemedicine. I'd be like, what? Snooze fest. And you're like, no, dude, you got to get there. Remember that? You were remember you were at the General Assembly with me trying to explain it, and I was like, what is nobody wants to talk about this. And you're like, John, man, you got to get this. This is big. I mean, this is entrepreneurism. And then here's when the light went off. I'll never forget this. You said to me, look, dude, you said, for years of Obamacare, we have been working on the demand side of healthcare, and it has failed. Now we've decided to work on the supply side. We're simply going to increase the supply to meet the demand. So the demand doesn't have to be managed or rationed. You simply increase the supply. And then the light went off, and I'm like, oh, now I get it. That was good, Ben. Remember that conversation?
I do.
And kindly, because I was like, I'm just not getting it. Like, who cares? But you were right, and you were on the cutting edge of it, and you're a true visionary in this field, and thank you for all you do, Ben.
Thank you, John. Appreciate you, buddy.
Ben Knotts, maybe the legislative director for Americans for Prosperity. He's like a dog with a bone. This guy's very persistent. He's unbelievable.